Hi, I'm Linda O'Day, and I'm UNPA's Regulatory Event Coordinator, and I am here with Larisa Pavlick. She is the Vice President of Global Regulations and Compliance. Hi, Larisa.
Hello, Miss Linda.
We wanted to talk a little bit about the preventive controls for human food virtual training that we'll be doing in May. So, Larisa, got a question for you.
Yes.
Why should dietary supplement companies have their employees attend this PCQI training?
Well, there's lots of reasons, but most importantly, and not to be too silly about it, is FDA says so. You have to attend a training or have someone with the background, education, training, and experience to manage your program for food safety. And under the new FSMA rules, that means that you have a preventive controls qualified individual on staff. And a preventive controls qualified individual by FDA definition states that they've received the education, training, background, and experience, including training in the rule using the standardized curriculum. So we utilize the standardized curriculum, which was developed by the Food Safety Preventive Controls Alliance. And the difference with our course is we try to help dietary supplement companies understand their responsibilities of this rule. It applies to all of the products that are regulated in the United States as food for anyone who manufactures, packages, or holds human foods, and dietary supplements are one of them. And our ingredients are fully regulated under the new expectations in the preventive controls rule for human foods. So for supplements, we're going to help you understand what that means for you and your operation, and then it's going to help you to understand what you need to do within a dietary supplement operation to qualify your suppliers, which are your ingredients in the supplement products.
Wow. Sounds like they could learn a lot from you, Missy. So, are there any recent FDA regulations or regulatory actions, I should say, that you've heard about?
Yes, I actually spent a little while on this today, and I searched the FDA's warning letter database for the last 30 days and for the last 60 days. And I was trying to pick out some trends, which I use that word loosely whenever I talk about warning letters, because it really depends on what is the FDA's priorities during the time. But in the last 30 days, most of our warning letters look like they're related to coronavirus claims. We also see a lot of claims related activity around depression and anxiety. And then interesting to me is that dietary supplement adulteration seems to be on the rise. And that'll be something that we cover during the course, because within your preventive controls, you're going to look at all the hazards that are reasonably likely to occur. And then you're going to evaluate what preventive controls are necessary and how are you going to verify that your suppliers are following preventive controls. And adulteration is one of those areas that we can actively be involved with our suppliers to manage those risks, especially when it's related to pharmaceutical adulteration and or what would be classified as a new drug because of claims usage. And we'll walk through that together during the course.
So FDA returning to on-site inspections. Have you heard anything? Do you think this is going to happen? And how does that affect our dietary supplement company?
Yes, I believe that FDA will be returning. And if we look at all of the language that's being used by regulators and within Washington, it looks like there's pretty strong hopes that we're going to be returning to living again as of July and after. So I think as of the second part of the year, we're going to start seeing on-site inspections again. Currently, if you look at FDA information, they're conducting drug and device inspections as on-sites. They have the regulatory authority to do drug investigations, also virtual. And remember, they have the authority to do FSVP inspections, or foreign supplier verification inspections, virtually. And for food and dietary supplement investigations, primarily since the pandemic restrictions came about a year ago, they've only been doing for cause inspections, but I do anticipate that that's going to begin to be on sites again. And again, my prediction is as of July. So my goal is to really make sure that all of our members are ready for those returns because they've had a year to prepare for FSMA inspections. And we want to make sure that the supplement groups fully understand the FSMA requirements for the preventive controls rule, foreign supplier, intentional adulteration, and be ready.
Perfect. So our course is May 18th through 20th, and it's 8 a.m. to 12:30 p.m. Mountain Standard Time. And we wanted to give all of our companies that work with us in the morning for training, and then you're able to do your job, so to speak, in the afternoon. So we're not cramming it all into one 8-hour day. So 3 days, May 18th through the 20th. And if you have any more questions for Larisa and I, or you want to register, then just send me an email at Linda, Linda, @unpa.com. And I think that's it. Larisa, you got anything to add?
No, I just look forward for all of our members to receive the training and be ready for inspection.
All righty. Bye.
Bye. Thanks all.